I am 92 years old, and my body is riddled with cancer. My doctor tells me I have 3 weeks to 3 months left to live. I am in extreme pain, and I am bedridden. I have lived a full life. I just want to go home and pass away in peace, surrounded by those who love me. When I talked to my doctor about physician-assisted euthanasia, I was told that it is illegal in our state, so I am doomed to live out the remainder of my life in extreme pain and bedridden. Physician-assisted euthanasia is only legal in one state, Oregon, and it is considered a crime in all other states. Unbeknownst to most people, physician-assisted euthanasia is already legal in some ways. First, let me tell you about the ways the physician-assisted euthanasia is already legal, just under different names. The first one is called a living will. It does not use the term physician-assisted euthanasia, but it is. People who don't choose to be a burden on friends and family and choose not to be attached to machines to maintain life prepare what is called a living will. They ask their loved ones to make the decision to remove machines that are sustaining life when there appears to be no hope of recovery. The second is called court-ordered euthanasia. This is when a family believes that the quality of a person's life has deteriorated past what they consider normal. The family then hires a lawyer and takes the case to court. If all goes accordingly, the judge orders passive euthanasia. Such was the case for Terry Schiavo in 1995. Both these cases are done in what's called passive euthanasia, where the doctors remove all food and fluids and the individual essentially starves to death. When a person is starving to death, their bodies start to convulse. The doctors administer medication to stop the convulsions from happening, so the family may watch their loved ones pass away in peace. The two examples above are considered choices, whether by a person drawing up a legal document asking the loved one to complete the process, or by a guardian asking a judge to rule in their favor and issue a court order. People make choices every day which would affect ours or someone else's lives. For example, C-sections, which used to be conducted for emergency purposes, are now routinely conducted for the convenience of the parents as long as specific circumstances are met. Physician-assisted euthanasia should be legalized as long as specific circumstances are met. Now I'm going to tell you what the specific circumstances should be. If a person is able to make sound decisions about their lives, are considered a legal adult, and have been diagnosed with a terminal illness with no cure and/or their life expectancy is minimal, a person should be able to choose to have a physician assist the process of euthanasia. Also, if a person does not have any illness and there is no minimal life expectancy but wish to end their lives, those individuals must seek mental health counseling to ensure they are of sound body and mind to make the decision to be euthanized. These two cases, if completed, would be done by intravenous euthanasia, which is accomplished in a more peaceful manner than the current legal means. For intravenous euthanasia, the doctor first administers a medication which induces a coma, then the doctor administers muscle relaxers, and finally a cocktail of lethal drugs. As more people join in this controversial debate, and it is my hope that lawmakers and doctors will see the current means of euthanasia are cruel, whether conducted under the guise of a living will or by a judge issuing a court order. With proper considerations and guidelines, physician-assisted euthanasia does not have to be considered just another form of suicide. It can be a choice made by those who are suffering. Legalize physician-assisted suicide and allow a person the freedom to make their own choices in regards to ending their lives on their terms without undue suffering and pain.